Fletcher's Solicitors are proud to sponsor the Mama Academy podcast series. We are one of the UK's leading birth injury specialists, trusted by families with the most complex legal cases. We champion better maternity care through every family's story. Fletcher's Solicitors, for every birth, for every baby, for every family. For more information about how we can help, visit www.fletchersolicitors.co.uk.
Hello, and welcome to the first episode of our brand new podcast series created especially for expectant parents. Throughout this series, we'll be joined by trusted experts to explore every stage of pregnancy, helping you feel informed, supported, and empowered along the way. In this episode, we're joined by Angie Willis, also known as the Eco Midwife, to explore the first trimester and how to navigate those early weeks of pregnancy. Together, we discuss what to expect, common symptoms and concerns, emotional well-being, and practical advice to help you feel more confident as you begin your pregnancy journey.
Well, welcome to this edition of the Mama Podcast. I'm Heidi Eldridge, the founder and CEO of Mama Academy, and I am here now with the lovely Angie Willis, who is AKA the Eco Midwife. Thank you so much for joining us today, Angie. We really appreciate it. Do you want to start by introducing yourself to everyone that's listening?
Yes, thank you very much for having me, Heidi. So I'm Angie. I've been a practicing midwife for 14 years. People know me most commonly for being on social media as the Eco Midwife, but I'm still working within the NHS sector at the moment. I've worked in a variety of locations. So I've been a community midwife, which was lovely for the continuity aspect. I've been a birth centre midwife, which is still hands down my favourite place I've ever worked, with the most wonderful teams. I've been a ward manager, a fetal monitoring specialist midwife, and I'm currently working on maternity improvement programmes at this moment in time as another secondment. I'm also a hypnobirthing teacher, an antenatal class teacher. I'm trained in baby massage. I'm a breastfeeding peer supporter. I've done lots of extra qualifications, including my master's, and I'm also a registered health visitor as well. So lots of different areas that I've been a midwife in over time, and love being able to share lots of different aspects on socials.
Gosh, well, that's a lot. You obviously have a breadth of experience and lots of wisdom that you can share today with our expectant parents, which is absolutely fantastic. So thanks for joining us today, because I'm sure we're going to find out lots to do with pregnancy. So this is the first episode in our new 10-part series, and so we're going to cover the early days today. So I'm just wondering, what are sort of the things that you'd want someone to know when they've literally just found out that they're pregnant?
Firstly, a huge congratulations to becoming pregnant. And that very first part of pregnancy can feel overwhelming. It can feel surprising sometimes, shocking. Even with a planned pregnancy, you can feel this roller coaster of emotions that suddenly kick in when you are pregnant, and feel what you've got to feel. It's okay to feel completely opposite emotions from one to the next. The first thing I would always do is I would try and reach out to your community midwives. How you refer yourself to your community midwifery service depends on your area, but so that you can make that contact and start thinking about the very first visit that you're going to have with them. This is what we call the booking in visit. And also, if you haven't been taking supplements such as folic acid, this is a good time to start your folic acid supplements, and also thinking about vitamin D as well, which I know we're going to cover a little bit later on. But start by thinking about the supplements that are going to help you in your pregnancy. And I would also look at the Tommy's information leaflets as well, and just start thinking about the information that you're going to want from a symptom perspective, because pregnancy can bring about a range of different symptoms, some of which can be managed quite easily and nicely, and others that might need that little bit of extra medical help or assistance from either your GP or your midwife as you go through pregnancy.
That's really helpful. So talking about those early symptoms, what things are sort of normal and what could we expect, but also might be a bit alarming at the same time?
Yeah, so in early pregnancy, there are lots of different symptoms. A metallic taste in your mouth, very common. One of the first senses to change often with pregnancy is one of the first symptoms is often your smell, the heightened sense of smell, the heightened sense of taste as well. Sometimes you can go off really common foods that you usually like. Food aversions are really common in that first part of pregnancy. As a result, nausea and vomiting, very, very common in the first part of your pregnancy, so the first 12 to 16 weeks. It's really common that around about 70% of women and people who are going through pregnancy will have some degree of nausea, some degree of sickness. When we think about nausea and sickness, though, if it is impacting on your day-to-day life, if it is something that you're unable to keep fluids down, you're unable to keep any food down at all, if you are feeling dehydrated with it, all of these things are absolutely worth getting checked over by your GP, and pregnancy sickness support are available here in the UK as well. And there's some great tools to know, is this normal pregnancy and nausea? Or is this abnormal and we need to start thinking about how we medicate, how we treat this nausea and vomiting in itself? 1% of everyone coming through pregnancy will have something called hyperemesis, and hyperemesis is the severe end of the pregnancy and sickness spectrum. It is a medical complication of pregnancy, and it does need medical intervention and medical treatment for that. So if it's impacting your day-to-day life, you're feeling lightheaded, dizzy, any of the symptoms that I've talked through, go to pregnancy sickness support, have a look at their fact sheets and their downloads, and then get yourself a GP referral from that perspective. It can also be really common in early pregnancy to feel lightheaded and really tired as well. And that's because what's happening in that first part of your pregnancy, you've got this lovely hormone called progesterone that's helping to open up all your blood vessels and reducing your blood pressure slightly. And so you can feel not very well in that first sort of 12 to 16 weeks, while progesterone is one of the leading hormones. And so taking regular rest breaks, making sure you're hydrated, thinking about the things like isotonic drinks might be quite useful from an energy perspective. Trying to eat maybe before you get out of bed first thing in the morning might just help to keep the nausea at bay in that very early part of pregnancy. And just keep those communications really open with your family, your friends, and your partners, so that they know what you are going through, so that they know that you are feeling whatever it is you're feeling, and they can help support you in some way, shape, or form too.
That is so helpful. Thank you so much, Angie, because I know that can be a real issue in pregnancy. My friend at the moment is pregnant and she's really suffering from hyperemesis gravidarum, and it's really, really bad, bless her. So all those things are really helpful. Thank you. And we've actually got lots of information on our social media, our website, and we've done a previous podcast actually with pregnancy sickness support. So people can always go and listen to that as well if they need extra help. So just thinking about having reassurance if people are feeling really anxious, especially in the first few weeks, they might be waiting for their first scan. What would you say to them in case it doesn't quite feel real yet because it's so early on?
I don't think that's an uncommon feeling. And one of the things about pregnancy is that our anxiety levels naturally increase. It's a way of our body helping to protect pregnancy. If we're worried about something, we're anxious about something, we're more likely to modify or change our behaviours to be able to then help keep the pregnancy safe and keep things going. So there is a degree of anxiety which is quite normal to increase in that first part of pregnancy, and especially with the roller coaster of emotions and all the symptoms that we feel. Speaking openly and honestly to your midwife, so important. So when you meet your midwife for the first time, talk to them about how you are feeling. Keep your partners in the loop the whole way, so that they are there to be able to support you. And the whole idea is that they are meant to be holding your hand through this process. They are meant to be giving you a foot massage and just listening to you. One of these things that can be really useful in relationships is, are you telling me just to listen, or are you telling me because you want me to solve something? And if you can start with that as a conversation starter with your partner, because often partners want to fix things, they want to make things better.
Yeah.
But often with a lot of the symptoms in that first part of pregnancy and not knowing what's going on until we hit that first scan and lots of other things that are going on, they can't necessarily fix and they can't treat necessarily. And so what you often need is, in that first part of pregnancy, just someone to listen to you, just someone to be there that you can just offload those worries, those anxieties, those concerns. It is really important, though, to tap into when something doesn't feel right. And if it doesn't feel right, if it feels maybe there's some pain, maybe you've got some bleeding, maybe there's something else that's going on, please never be afraid to call your GP surgery 111 or your community midwife office. And that's because, again, there can be some complications in that early part of pregnancy. And if you can tune into those instincts and think, oh, that doesn't feel right, that wasn't the same as what it was yesterday, you're more likely to seek the support that you need and the help from a medical perspective if there's something that doesn't feel quite right. And journaling can be a really good way as well. So sitting down, journaling, and just thinking through the emotions that you are feeling, what might help you. And there are lots of areas across the country that have got some pregnancy wellbeing services as well. I'm aware that it is a postcode lottery, so it does depend on where you are in the country as to whether it exists or not. But this is where your community midwife can really come into their own, because they'll know what your local services are like, where you can go to, where you can access that support, and so that you don't feel quite so alone. And I know it's a bit of a taboo. Should you tell people? Should you not before the 12-week scan? Because of the worry and the concern of miscarriage. There is no right way. It depends on what you're feeling, how you're feeling, and just thinking about, even if sadly there was baby loss, which does impact on 1 in 4 pregnancies, would you feel better knowing that people were there to support you, or would you not? And that depends on your own thoughts, your own feelings. There is no right way of doing this. There's no right way of parenting. There's no right way of pregnancy in general. But you might want to think about, do I want maybe just a couple of people to know, so that I've got that support all the way through and they're there right from the outset, because everyone has different needs and wants in their pregnancy.
Absolutely, that's so important. I think a lot of our listeners are going to be sharing this episode with their partners now, especially the bit about the foot massage.
Even running a nice warm bath, like a nice lukewarm bath, putting the shower on, there's lots of things that partners can do to support you. It might be that they are the ones to have to clear out the bins and feed the cat because you can't physically tolerate these things, the things that are triggers for nausea and vomiting. If you've talked about them in your pregnancy with your partner, they can be the ones to really help manage some of those feelings. So
definitely. And you touched upon the booking appointments there, and I'm just thinking, for anyone that's listening that's not quite sure how to register with a midwife, it can be a bit confusing because we get a lot of calls regarding this. There is information on the Mama Academy website of how to do it, because you can put in your postcode and it'll bring up your nearest maternity unit, and then on their website is the link of how to register. And what I usually say is, the rule is, if you've just registered, you need to wait at least sort of 10 days before you hear with an appointment. Otherwise, if you're registering early, you want to get that appointment for when you're around 10 weeks. Would you say that's about right?
Yeah, so the recommendation is to have that very first appointment with community midwife between 8 and 10 weeks. That's the recommendation across the country, as you should ideally see a midwife in that time. And in that first appointment, there are lots of things that happen. How you get that appointment does depend on your area. Some are phone calls, some are online booking forms. Everywhere is slightly different. And this is where having a look for your local maternity service. So, for example, if you were in, say, Manchester, for example, you could search Manchester maternity unit and it should hopefully come up with early pregnancy, and then all the ways that you could actually refer yourself into that service. It really does depend on where you are as to how you get that first appointment. But what you have said, within 10 days, you should have had a phone call, you should have had some sort of correspondence to say, this is where your first appointment will be, this will be who it will be with. And then at that very first appointment, your midwife is going to ask you about your entire life history, your entire medical history. There is no question that we don't ask in that first appointment. And it takes about an hour and a half on average for that very first appointment. So come prepared to be there for quite some time. And the reason we ask so many appointments is because this helps to personalise your pregnancy, in the sense of what scans you might need. Do you need to see a doctor in your pregnancy? Do we need to recommend certain medications based on your medical history? Is there anything else that we need to be aware of that we can offer you more support for? Can we signpost you to other services that might be able to help you? There's so many different aspects of that first appointment. We'll be taking your blood pressure. We might be taking your bloods in that appointment. Some of those bloods do happen when you go in for your first scan, again, dependent on the area that you are having your baby in. I'm aware that that can vary. But we'll be talking through what blood tests we'd recommend in that very first appointment and why we are taking those bloods for these things. Be taking your blood pressure. We'll be recommending weighing you and taking your height as well to calculate your BMI. We do lots of things in that very first appointment. It's a good idea for your partner to come along with you as well, because we also talk through things that will help keep you and your baby safe in pregnancy, the vitamins that we recommend, the scans that we recommend and why. And then we start thinking about the information that you'll have to take away, that you can start thinking about, okay, as this pregnancy continues, what phone numbers will I need if I've got any concerns? Who do I call from here on in? Where might I want to have my baby? You know, is it my local unit? Is it somewhere else? Am I sat between 4 different maternity units and I've got to decide which way I'm going to go in terms of which hospital I want to go to? Am I going to start thinking about where I might have my baby in terms of like home, midwife-led centre, obstetric unit? So you'll get lots of information, and it's not for you to read immediately, but it's to go, okay, now I can start processing just one chunk of information at a time, and that helps to support you through your pregnancy that way.
And I'm glad you mentioned the contact numbers as well, because again, we get lots of calls saying, who do I call? So again, it's important whether you've got the handheld notes or whether you're digital, to make sure you know exactly where those numbers are, because there's different numbers for different stages of pregnancy and for different situations. We have our pregnancy passport, so you can write all the numbers on the front. But again, it's really good to store them all in your phone, because in case you leave something somewhere, or you know, you go and visit a friend and you don't have it on you, it's really important to have those numbers to hand, because you never know what can happen at any point really when you need to get assessed, say.
Absolutely. And lots of areas will give out the like leaflets, you know, like the mama leaflets and things like that, where it goes through the signs and symptoms to be aware of in pregnancy or fetal movements. And often they'll hopefully either put the numbers down, or they will have signposted you as to where they are within your notes.
Yeah, that's so helpful. And what can parents expect from the scans? What are you looking for at the different appointments?
So if you are on a low risk care pathway, the scans that are recommended as standard across the NHS here in England are your 12-week and your 20-week scan. Now, for those who are high risk, you may have additional scans in addition to this. For example, you might have some growth scans at a later stage. You might have scans to check the presentation, so whether your baby's a head down or a bum first baby in some areas. Very aware that every area does something slightly differently at 36 weeks. There is no national recommendation, but some areas do offer an additional scan for some people. So when we think about the 12-week scan, we're looking at certain things on that 12-week scan in what we recommend. And we're looking at the crown rump level. So that's the measurement of your baby. And that tells us how far along you might be in your pregnancy and helps us to date the pregnancy. So it gives you an estimated due date from that. Also looking at other aspects, you know, like whether you're having one baby or multiple babies at this stage. And that tells us, you know, how many babies are on board. And it's look at some really basic structural perspectives of your baby on that 12-week scan. And the other thing that's recommended at that 12-week scan is to offer you an option to screen for certain conditions for your baby. So what do I mean by that? So screening looks at the likelihood of you having certain conditions. And in this case, the screening that is offered at this point is Down syndrome, Edwards and Patau. So what's the likelihood of your baby having one of these 3 genetic conditions? So on that 12-week scan, they take a measurement from your baby and they combine it with a blood test. They combine it with your age, any other risk factors. And what they do is they pool all of that together. So all of those different things at the 12-week scan with the blood test, with all the other factors within your medical history. And it comes back with a risk result. And what I mean by that is you will get a number. So it will be 1 in, and then however many numbers that there are at that point. So, for example, your chance of having a baby with Edwards syndrome, which is a life-limiting condition, might be 1 in 15,000, for example. And as a result, you've got a 1 in 15,000 chance of your baby having Edwards. If, on the other hand, it came back as really high risk, so for example, if it came back as 1 in 50, you've got a 1 in 50 chance of your baby having this condition. And if it came back as high risk, what we would often recommend is that you would have a screening team, so a midwifery screening team, give you a phone call, they'd talk you through this result, they'd talk you through your options at this stage and your next steps if you wanted to do that. You may also be seen by an obstetrician at that stage as well. And what they'll do is they'll talk about diagnostic testing at this point. So screening gives you a risk result, the likelihood of your baby having this. Diagnostic testing helps to say yes or no, your baby does or does not have this. And diagnostic testing does come with benefits and risks and is only offered to those who have a much higher chance of having a baby with these conditions. And then from there, they will then talk you through your next steps about continuing the pregnancy, or whether there's any additional screening or tests to put involved. For example, you might have additional blood tests in your pregnancy. You might be recommended to have additional growth screening and growth scans in your pregnancy. There might be other options to think about with labour and birth, for example. They might be able to put you in touch with support services relating specifically to those genetic conditions, for example. So they'll be able to support you more accurately if you've chosen to have this screening. But it's important to note that the screening for anything in pregnancy is an option, it's a choice, you can opt out of it. And you can have the 12-week scan to date your pregnancy, look at your baby, without needing or wanting to have these 3 tests. You don't have to have that blood test to look for Down syndrome, Edwards and Patau's, and it is a choice. Then we start thinking about the 20-week scan. So the 20-week scan, we're looking at your baby in a lot more detail. We're looking at the heart, we're looking at the brain, we're looking at the kidneys, we're looking at how big your baby is on the centile charts. We're looking at your baby in a lot more depth and detail. And we're also then looking at the placenta and where that is located. So is the placenta where it should be? Or is it covering the exit of your womb? Is it low lying? And in which case, if it is low and it's close to the exit of your womb, we would recommend additional scans later on in your pregnancy just to make sure it comes up. The majority of them do, just to provide some reassurance. And that's just because your uterus is still growing and developing, and it often moves up with that growing uterus. But at that 20-week scan, we're looking at a lot of detail. We are plotting your baby on the centile chart. So a centile chart is if I lined up 100 people, the shortest and the smallest person to the tallest and the biggest person at 100. We plot your baby somewhere on that, based on your baby's weight, based on your baby's length, based on their leg length, based on their head circumference. We do lots of measurements on that one. And that gives us an idea as to where your baby is falling on that. And we would expect their growth to kind of follow that centile throughout your pregnancy. For those who've got additional risk factors for baby not growing so well in pregnancy, for example, if you're a smoker, you've got a really raised BMI, if you've got certain medical conditions that might impact on the growth of your baby, if you develop preeclampsia later on down the line, we would recommend additional scans. And what they do is they look back at your 20-week scan and where your baby was measuring at that point, and then they compare it with how far along in pregnancy you are as to whether your baby is still following that line or is going up or down, depending on where you are in your pregnancy, or whether your baby is growing perfectly, as we should expect. So those growth scans are recommended usually anywhere between 28 and 32 weeks. It depends on what your medical history is as to when your growth scans would be recommended to start. For anyone who is really high risk, sometimes there is an extra scan a little bit earlier than that, but that's a really individualized care plan to tailor. And then assuming all is well, after your 20-week scan, if you're low risk, that is usually it for scans, unless you're concerned about your movements at any stage, unless your hospital have or your midwife has got any concerns with your growth in your pregnancy, they're worried about the size of your bump, there's any other things that they think we would recommend this scan, and this is why we would recommend this scan. As always, it is your choice. You don't have to have any scans in pregnancy at all. We do recommend at least the 12 and the 20-week scan, and for those with individual factors, the additional scans, just to keep track of you and your baby and to try and help keep you safe. But it is always your choice, and you can say yes or no to anything that you would like to have in pregnancy. What we give you as advice should always be backed up with a why we are telling you and advising you to have these things.
That's really helpful. Thank you. We're doing lots of work on fetal growth restriction at the moment, and looking at different charts, etc. So there's lots of information about that on our website as to what chart your hospital may use. I'm just wondering what questions we should ask at the appointment, especially when we're early on in pregnancy.
Yeah, so I would always have a list of questions to take in with you. So if there's any questions that come up at any point in your pregnancy that you want the answer to, note them down, pop them on a piece of paper. Really useful, so that way it helps to not only get your questions answered, but it also helps to build that trust between you and your midwife as well, or your doctor if you're under the care of a doctor, or any specialist teams as well that you might be under. So anything that pops up in your mind, you think, I just want to ask this, pop it down so that you've got it there ready for your next appointment. And then it's just thinking about things that you can ask at any appointment. Why are you recommending this? Because this, again, helps you to feel part of that process. It's quite easy to feel like a passenger sometimes within pregnancy, because we've got a list of guidelines, we've got a list of frameworks, and you will probably fall under one of these somewhere along the lines. And so it becomes almost automatic as a midwife to go, okay, we recommend this and we advise this, and we don't always say why. And that why is really important for understanding the importance of stuff, but also the option to be able to go, that doesn't sit right with me, and I'd rather not have this test or this screening or this scan, or I'd rather not have this. And that's about personalising your care plan and your pregnancy. So at every point that you see your midwife, ask them why they are checking your blood pressure, for example. What is it that we're looking for in your blood pressure? What is it that we become concerned about? And what's the idea of us doing this at every appointment? Why are we measuring your tummy? Why are we doing that throughout your pregnancy? Why do we recommend those 12-week and that 20-week scan? Why are we offering things like screening for additional chromosomal abnormalities in your pregnancy? Why are we recommending these things? Because then once you understand the reason why, you can go, I like that, I'm going to accept that, or actually I'm going to decline that because that doesn't work for me. And that's absolutely fine. And as your pregnancy continues, you'll find that the number of recommendations about place of birth, choice of birth, pain relief management, and thinking about sort of your birth options that will come up later on, they'll start increasing. So ask the question, why are you recommending this? It can be really useful. And also asking, are there any other services, any other sort of options within my area that can also help me with whatever it is that's going on? I said at the start about there are some areas of pregnancy wellbeing services. Are there areas with pregnancy yoga, for example, that will help with mental well-being, but also help with baby getting into a good position for labour and birth, helping your pelvic floor, for example? Are there services that will help you with pelvic pain or anything like that? It's about asking that, is there something else out there that might help me manage my symptom with this? This is going on with me and I'd like some extra support with this. So why, and then that, and then any other questions that you've got that you've taken a list of in.
I love that. I'm always saying that to people, ask as many questions as possible, because if you fully grasp and fully understand why all these things are being done, then you're more tuned into your body, and then you recognize when there might be a problem a lot sooner and a lot earlier. And it makes you think, oh, I need to tell my midwife that straight away, because I understand the process and I understand why she did those checks last time. So I'm gonna call the maternity unit now and report that. So it's so important to do that. And I know you've talked about folic acid, the importance of folic acid early on, and you mentioned other sort of vitamin supplements. What would they be? What else should women be considering taking in the early days?
Yeah, so folic acid is the main one. Ideally, taking it before you're pregnant. So if you're planning on conceiving a baby, ideally this should be taken pre-conception. And we recommend 400 micrograms for most women and people who are planning a pregnancy. What this does is it helps to reduce the chance of something called neural tube defects and spina bifida. So that's where part of the spinal cord doesn't quite completely close over, and that can cause complications and problems for the baby who is developing. So if you can take that before you have your pregnancy or the moment that you find out, this will help prevent the neurotube defects from happening. Now, there are some women and people who will need a higher dosage of 5 milligrams, and this needs to be prescribed. And this might be because of things like raised BMI, for example. So if you've got a raised BMI, that might require an additional dose of folic acid. There's one other factor that's gone out of my brain. Epilepsy. If you've got epilepsy, then again, the 5 milligrams of folic acid is also recommended as well. So there are some people who will need to take a much higher dose of folic acid. And the best way to tell that is to give the maternity units a call just to ask, I've got this condition and this is what I would be recommended or advised to have. This is also where preconception planning comes in for those with things like epilepsy, for example, or even diabetes as well. Anything where you've got like a medical condition that might just need a little bit of extra support during pregnancy somewhere along the lines can be really useful to talk things through before you're pregnant so that you've got all this in place. Then it's a much easier referral. It's much easier to get to your GP and say, I need this is what I'm recommended, can you do this for me? As opposed to having to sometimes have a battle if they're unsure of what the guidance and the pathways are for that. The NHS online service has got a really good, clear guideline on folic acid in pregnancy. So that's a good tool to be able to take along if you feel like you need that higher dosage prescribing by your GP or your midwife. The other one that we recommend is vitamin D. So vitamin D and having vitamin D just in the adult population is really beneficial for all of us. We should all be taking a supplement, especially over the winter months. But for pregnancy, having vitamin D as a supplement has been correlated. So that's an association to a lower chance of miscarriage in that first part of pregnancy. So we recommend a supplement of vitamin D, just the standard adult, 10 units is what we recommend for dosage. And so that will hopefully reduce the chance of miscarriage as well. The other one that you can consider, and it's not recommended as standard by the NHS, but there is a lot of research for it. And it depends on your diet more than anything. If you've got a really good diet with high omega-3, so you've got lots of good fish in your diet, then you don't necessarily need omega-3. But if you're someone who struggles to get a daily dose of your omega-3, you don't eat much in the way of fish, omega-3 taken from about 20 weeks of pregnancy has been correlated and associated with a lower chance of preterm birth. So it just depends on what your diet is like more than anything. And it's one to discuss with your midwife as to whether she'd recommend it for you or not. But it does depend on what your diet and your lifestyle is like around that.
That is so helpful, thank you. And you mentioned some top tips earlier to deal with pregnancy sickness. What would your top tips be to sort of deal with, low energy, mood changes, those sorts of things?
Rest. Prioritize rest if it's at all possible. And I know that's really easy for me to say on a podcast episode, and fully aware that that's not always realistic when you are running around after other children and having to do your day-to-day work and your day-to-day jobs. But if you can prioritize some of that rest, if you can have a little siesta in the afternoon, do that, go back to bed and put your feet up for a bit, so that you can get your energy levels back. Have a conversation with your midwife as well. One of the blood tests that we recommend in the first part of your pregnancy is for your iron levels and to check your iron levels, your hemoglobin levels. If that comes back as low, then we'll recommend an iron supplement to just help you feel a lot better and to bring up your hemoglobin, your iron stores. And that can sometimes be quite common if you've got other children or if you've had short pregnancy intervals, that you can be slightly iron deficient in those pregnancies. So having that checked over in that first part will help with that. Eat little and often as well. So if you can eat little and often, you're having small bursts of energy as opposed to big meals where you're going to have a glucose spike where your sugar levels go up and then you suddenly drop and plummet later on down the line. So eating little and often can be really useful from an energy level perspective as well. And it's just about trying to prioritize yourself. And like I said, I know that's easy to say. As a midwife on the other side of it, I'm fully aware that not everyone has that privilege or that luxury in life. But if you can, even if it's just a 20-minute, take some time out, look after yourself, even if it's you just fancy a bit of a walk around the block just to make yourself feel a bit more refreshed, whatever it is, whatever well-being looks for you, try and factor that in on a day-to-day basis to help with that rest where it's possible.
That's reminded me that I was doing that, but I've slacked recently. So I think I need to get into doing my little walks again, because they were so good for the mind, to help, help reset, a little bit of time out. And on that note, I'm just thinking about, emotional well-being, all the hormones going up and down. Have you got any tips to deal with the emotional roller coaster that pregnancy brings?
Just speak openly about it. I know we've talked about it a lot so far, but talking really openly with your partners, talking really openly with whoever's going to support you through pregnancy, and get that support that you need from a listening perspective. Most people in pregnancy will feel that emotional roller coaster, that up and down feeling, and that's really common. And it's okay to feel that, and it's okay to have moments where you go, what have I done here? Why am I pregnant? It doesn't mean to say that you don't love the baby that you're growing or anything along those lines. And it's remembering that with anything in life, our emotions are not binary. They are often conflicting. They are often the complete opposites. You can feel one thing one minute and then suddenly you feel the opposite the next. And it doesn't make it negative, it doesn't make it bad. It's just acknowledging that pregnancy brings about a range of symptoms and a range of emotions. And there's a huge life change going on. You're going through pregnancy, which is a massive transition. And it's okay to acknowledge that. And it's okay to acknowledge that becoming a parent is another transition, and to acknowledge that further as well. And if you're open and honest about these things and you've got that support, it often makes it feel easier to manage. And this is where journaling can really come in useful as well. It can also be where support services can be useful from, a pregnancy wellbeing perspective, or starting to almost like self-coach in some ways, that coaching style where you go, okay, what am I feeling? Let's tap into that. What is it that's making me feel like this today? How do I manage this? Is there something that can be done to help with this particular emotion that I'm feeling? Or is it something that I've just got to ride through? I've just got to get through. What is it that I am feeling in this moment? And this is where speaking openly to your midwife and hopefully having that trusting relationship with your midwife can be really useful, because they can support you in lots of different ways, whether that is just in the appointments that you've got, or whether it is that you have some additional appointments. Everywhere is different in what they can offer. But sometimes just having that extra person to be able to relay things to can really help. And sometimes it's just the reassurance as well. And this is where, support lines can really help, support services. There are lots of things out there that you can access in your pregnancy, just to pick up the phone and have someone listen at the other end of it as well.
Absolutely. I'm just thinking, you're known as the Eco Midwife. Do you have any sort of swaps that pregnant women and birthing people can do to have a more sort of sustainable pregnancy?
Yes, so it's not just about environmental sustainability, but we're also aware that financially pregnancy costs a lot of money, and so does having a baby. That they aren't cheap. But there are lots of things that you can do. And it comes back to the principles of reduce. So what can you reduce your consumption of? What can you use that's reusable? And then recycling at the other end of things. In pregnancy, it can feel really overwhelming. And I've worked at many baby shows, and you walk around a baby show and you can just see the absolute look of horror about, oh my God, does my baby need all of this? And that overwhelm and thinking, oh my word, like, do they really need all of this? And they often don't. There are some real staples, there are some real basics that you absolutely have to have for your baby. You need somewhere for them to sleep. You need some way to transport them. You need something to put them in clothing wise. You need some nappies, and you need a way to feed them. And everything else is an optional extra. So when you're starting to think about what you might need, writing a wish list of the things that are must-haves. So all of those 5 things are must-haves. You know, you've got to have a way to be able to transport your baby, you know, whether it's a car seat, a pram, a sling, whatever it is that you know that you're going to use. But you might not need all 3 of those. You know, you might be the person who goes, I'm not going to use the pushchair because I've got another baby already, so I'm going to use the sling because I know from last time that worked better, and I've got a pushchair for my older child. It might be that you want a pushchair because for you a sling isn't going to work, for example. Everyone is very different in those terms. So it's about the must-haves for you and your lifestyle and your family dynamic. And then everything else is this would be nice to have. Let's put that on the list for an Amazon next day delivery special. On the, you know, flip side of it, when I suddenly go, 3 o'clock in the morning, yes, I definitely need that now. This is going to come in use. So you've already reduced your consumption from that perspective. The wish list can be really good for baby showers so that you get the things that you want and you don't get like 100 tiny newborn baby clothes when you know that you're going to have a £9.5 baby from your growth scans, for example. So the wish list can be really good for not only saving you money, but getting the things that you really like, the things that suit you again as parents and as a family. And sometimes it even means that people chip together for some of the bigger buy items as well. When you're thinking about sort of products that you might buy, you know, are there more sustainable options out there? You know, are there more sustainable options, thinking about things like reusable nappies, which is how I got into sort of the eco world, because you're reducing your consumption, but then you're also using something that is reusable, and you're potentially less likely to need things like nappy creams because of less chemicals on baby and things like that. So, you know, are there more sustainable options in that category that I can then buy? And can I buy anything secondhand? I love secondhand. Secondhand saved me an absolute fortune with my girls. Pretty much we kitted out the wardrobe for my eldest for less than £50 on big Facebook bundles, you know, of the 3 to 6 months, the 6 to 9 months. And children don't care about the fact that their clothes or their toys are secondhand by any means. And so, you know, there are lots of things that you can buy secondhand. Pushchair systems you can buy secondhand. The things that you have to buy brand new from a safety perspective is a cot mattress. So it's recommended from safe sleeping perspective to have a brand new cot mattress with each baby, and that's because you need a firm flat mattress for them to be placed onto. And also a car seat. So they're your 2 main things that is recommended to be brand new. Pretty much anything else you can get secondhand to a point, and you can use secondhand items. You know, you might even have a friend or a family member who is, you know, has a older child who's a few months older who can lend you stuff. And also think about hiring things as well. So if there's something that you think, I might use that, but I'm not sure yet, look into whether you can hire stuff. You know, you might hire a TENS machine, for example, for labour and birth. You might want to think about hiring a breast pump. You know, do your local maternity unit have breast pumps to hire to be able to try before you buy? Is there a sling library near you where you can try different slings and you can think, oh, actually, this one suits me better than this one? And then you can hire it for a few weeks and decide whether you're going to then go on to buy it as a result, or buy it secondhand as another option.
That is such a good idea. I love that. And I use a lot of secondhand things because you use them for such a short period of time as well. You know, babies grow quickly.
And maternity clothes. I mean, like, how long do we use maternity clothes for? And you can spend a fortune, they are very pretty, often maternity clothes, but you can buy them off Vinted or Facebook Marketplace and get your money's worth out of it. There are some hiring clothes companies as well where you can use it for a shorter period of time. You know, if you've got a wedding to go to or something else that's a big event, you can often find clothes stores that now hire out outfits that will save you some money too.
That is such a good top tip. Thank you. Well, I'm really sad that this episode is coming to an end because I could chat to you all day. But I'm just thinking, what's the one thing that you would like parents to remember from this episode today?
Speak openly and honestly. I think your emotional well-being is so important in pregnancy, and the more you can talk openly about pregnancy, about the emotions, be truthful, be honest about it, talk to your midwife, talk to your partner, and take along that list of questions. It will help you feel more reassured during your pregnancy. And never be afraid to ask for that help. That is what your maternity services are there for. They're open 365 days a year, 24 hours a day, including on Christmas. They are open and just learn about what's normal and what's not, and listening to your instincts for that.
I love that. Thank you so much. So how can people find you on socials? You're obviously the Eco Midwife on Instagram and TikTok. Is there anywhere else?
So I'm on TikTok, Instagram and YouTube, Facebook as well for the Eco Midwife.
Fabulous. Well, thank you so much, Angie, for being with us today.
Thank you very much for having me.
Fletcher Solicitors are proud to support the Mama Academy by sponsoring this podcast series. At Fletcher Solicitors, we champion better maternity care. For every birth, for every baby, for every family.
If you enjoyed listening to this episode, share it with a friend or colleague. Make sure you follow us so you don't miss out on our next episode. If you'd like to support our work by fundraising or volunteering, please email contact@mamaacademy.org.uk. For more information on pregnancy and maternity services, please visit our website at www.mamaacademy.org.uk. We're also on all of your favourite social media channels. See you next time!